Right.
And this is a talk basically which I gave just few days ago at our national pedicon. So this is where we are saying, and a few more things will be very useful, is that I'm a WHO International Global Expert on ICF, International Classification of Functioning, Royal College of Pediatrics and Childhood UK Examiner for DCH UK and MRCPCH UK. And then Sydney University name has changed. It's called Sydney Child Health Program. But we have now got I'm a director of postgraduate diploma in early intervention for neurodevelopmental disorder through West Bengal University of Technology, which is called MACAUT, Maulana Abul Kalam Azad University of Technology, through their collaborative program, CCPTR program. So this is something that we'll start talking about. Now, in Pedicon, why they have asked me to talk about early markers of neurodevelopmental disorders, because you can see the first line of my introduction says that I have been able to establish India's first corporate healthcare setup, Child Development Center at Apollo Gleneagles Hospital, Kolkata, which is now Apollo Multi-Speciality Hospital. So when we talk about early markers of neurodevelopmental disorders, why are we doing it? Because these things may not appear in isolation, especially during the early years. So it is a norm.
যত দেরিতে খাবে তত দেরিতে টেনে যাবে, ড্রাই ওয়েদার তো, সেই জন্যই বললাম কথাটা। রেখে দিলে আরো টানবে।
Thank you. So it is a norm that if there is autism, there are co-occurrence of other disorders. It is very rare. It is not impossible. Just yesterday we have diagnosed a pure autism. Apart, the child does not have ADHD, child does not have developmental delay. So these kind of things are very rare. Mostly it will come with multiple other things, which is why we need to know about the early markers, and they are clinical and they are technological. The clinical ones are the ones that I have a lecture which I give in the international forum through the Sydney Child Health Program, which runs in 30 different countries. And when we say about visible disability, which are usually motor disability, and there are invisible disability. In motor disabilities, we talk about delayed motor milestones, floppy baby, stiff baby, led to roll, and then through to C-shaped spine, opistotonic, and something like late cruiser, not able to talk, not able to walk, limping, abnormal crawling, bottom shufflers, commando crawling. This is what we teach those international students, that all these things you have to be sure that you are only dealing with a motor disability and not other comorbidities like drooling, bunny hopping. All these things can actually act as problems which also can have autism along with it. But we now need to really be focusing on, especially on a World Autism Day, when somebody has swum from Sri Lanka to India at a record time in the world, a girl of 24 years, a daughter of an army major, then we must know that we will have to pick them early for them to be able to do such things. You probably know that one of my patients has just been picked up on a national squad, junior under 19 squad, and we need to pick them up very early. They were picked up much earlier. Many of my students are now doing wonderfully well in the school and academic scholars, and they are going to normal schools, doing drama, dance, sports, and getting prizes in all fields. That only happens if you pick these things at an early age. No child is clumsy, no child is funny, no child is lazy, no child is naughty, no child is dumb. It is us who look at them at that way. What they are doing is they are showing some signs where adults should be there to pick it up. For example, this loner is the second commonest symptom in the pediatric symptom checklist. List. Spends time alone. If we don't know these things even now, I think we are not doing our job very well, which our experience in the Apollo Multi-Speciality Hospital, Kolkata Child Development Center shows that if we pay attention to this, meaning if we listen to parents well, there is a symptom in pediatric symptom checklist which says visits the doctor finding nothing wrong. So what, as doctors and healthcare professionals, we should know that if one doctor does not understand your concern, that doesn't mean that there aren't any doctors who will. not understand. These are available in child development centers. They are called developmental pediatricians, and they will take all these symptoms very, very seriously, because they know through their training that no child is a constar unless adults fail to diagnose the symptoms early in life. They will not lie ever. Especially autistic children cannot lie unless they have been missed and they are taught to lie. In a society where lying is a norm, they are really disturbed because they can't lie well, so they get caught very easily. But if you really enable them, they will then swim the oceans, really, literally. I mean, as you can know now. So you will know when it is really hitting you if you are aware of all these red alerts in the antenatal period and natal period. Like somebody with bad obstetric history, somebody with valuable pregnancy are all textbook risk factors for early detection. They need to be referred to the developmental pediatrician in early years. Somebody who did not cry at birth, we all know. But we must also know to note, record, and send, refer if they have feeble cry at birth. Because neuromuscular disorders are so common in Asian societies and societies where there are inbreeding. It's so common, and some of them are so subtle, you will miss them if you do not record those things in early life. And then the doctor doesn't have any opportunity to know that history of early life of all these things. You must record, and I'm very thankful that I work in an environment where everything gets recorded in typing and given to the parents. But parents need to know that they need to the value of these things. Basically, a neonatal jaundice might not be serious. When it was neonatal jaundice, that might have got treated well only if you know that cohort studies will show that from this group of children you will have more writing difficulties in later in life. So these are the important things that everybody needs to know and understand, that at early infancy you can easily pick up whether the child is social smiling by 3 months of age, head holding by 4 months of age, saying pick me up by 5 to 6 months of age. Especially we know about poor eye contact, but what is important here to know that not all autistics have bad eye contact. They may have completely normal eye contact but still be very autistic. This is very important for you to know. For example, in the past, people used to say bottom shuffling is a normal developmental variant. Now we know bottom shuffling, commando crawling, any of these things, we got to take it seriously. It may be normal, but unless an expert lays his or her eye on that child, it may become dangerous by the time when the neural plasticity and ability to treat is gone. So somebody with an awkward gait or poor speech or poor peer interaction, all these things, double sitting, bunny hopping, too active, aggressive, everything, all these things, people used to say, so are we going to take everything to a developmental pediatrician? No, of course not. These are the things which international students learn, and they should refer these children to developmental pediatrician in the early age. Why early age? Because otherwise we have problems in early school age, middle school age. And what sort of problems? Reading difficulty, writing difficulty, memory problems, clumsy child, cannot tie shoelaces, very friendly, not friendly, dislike schools and class. Like dislike schools is item number 5, symptom number 5 in pediatric symptom checklist. Sorry, it's item number 6. Has trouble with teacher is symptom number 5. So you have to listen to your textbook at least. And those are the ones you need to send. Common recurrent ailments like recurrent abdominal pain, top of the pediatric symptom checklist is recurrent aches and pains. At least read your textbook. And if you read your textbook, these are the ones that you will definitely refer to a developmental pediatrician very early in their age, when the full neural plasticity is intact. A child smacking the lips, they develop leak dermatitis if you don't help them. And then you send them to a dermatologist and they treat the leak dermatitis, and not even send them to a psychologist. And psychologists do and treat, they don't treat the biological part of it. So the child remains half treated. In to this time pedicon, this half treated one got very highlighted, because now many developmental pediatricians are finding half treated autistic children who are danger to the society, because autism must be treated fully. If you fully treat it, they get completely normalized, as our evidence, current evidence says. So we don't want somebody who has a cheating behavior, lying behavior, because these are preventable things. We don't want them to have suicide ideation, because it can be prevented. We don't want somebody who is flashing car, having flashy boyfriend or girlfriend, or getting interested in pornography, because these are prevented in early years. You won't get a child interested in those sort of things if you treat them well. None of my children are interested in bad food, bad habits. You can see them and you will find out that they are not. They will eat fruits and vegetables, they will eat healthy, and they will not have any problems because you have caught them early. And when is early? In our specialized center, we catch them as soon as we get them. So from birth until 18 years of age, we treat it as early as possible, because we have normalized all these children. One 18-year-old has now become a doctor who used to hit, punch, and kick his parents and would not go to school. His IQ is 154. So he's now a complete full doctor with no symptoms that anyone can tell that there is a problem. So we call this model Kolkata development model, because this was invented through indigenous method in Kolkata, which has been presented everywhere. This is a London conference we are talking about. We have presented the poster is in European Society of Pediatrics. We have also presented in European Academy of Childhood Disability. Especially, we have presented in the Royal College annual conference in Royal College of UK Pediatrics, because these are all evidence-based things. We say we can pick them up even before 3 months of age, as per evidence. What is the evidence? General movement assessment, which is a scientific something, and we have arranged those trainings in Apollo, and there are scientific basis of this early jeopardy. We can detect endogenously generated activity abnormality at a very young age, because we are the trained ones to assess GM movement. We are trained in basic GM movement. There are about 250 to 300 professionals throughout India trained. And in Kolkata, we have got 25 total people, 25 in India trained, some of whom have been trained. They have come from Germany, they have come from Australia, they have come from Malaysia, they have come from UAE. This is the group which has all these members all around, right? And our trainer is the trainer in the world. She goes, this sari clad lady goes to University College of London and teaches them the same thing, but it costs there over 1000 pounds, which costs about 150 pounds in our place. So there are absolutely videographic telemetric evidence through which we can with complete prediction detect the risk of cerebral palsy with 98% accuracy at birth up to 3 months of age. And same assessment brings out autism in 60 to 66% cases. The person who arranges in UCL is Betty Hutton, who is with me in the photography. She's also UK's one of the two trainers of Bailey's assessment, which we are trained from there. Me and one of my colleagues is trained. Both of us are in Apollo. On top of that, we use something for which Apollo has recently published something where it says what we are going to do nationally through Indian Academy of Pediatrics on emotional development. And we have done investigations on this GM assessment so that we can make this GM assessment available every doorstep, almost free of cost, because we now know that we can detect early at birth learning disabilities and global developmental delays as well. These evidence is becoming available. It's not fully established yet. It is established in the scientific domains. Practice domains, we are yet to develop the expertise so that we can adopt this, but we need to know scientifically global developmental delay, ADHD, all these things. We have already make use of it because we have all the expertise in our place. Kolkata development model has been presented in Paris, and we were the highest amount of scientific acceptors. In the world, Calcutta Child Development Center has maximum number of scientific acceptance. So we say disability is only in the eyes of the beholder. It is not our say only. We do multidisciplinary management, and we have enough technology on earth to erase the face of disability from the planet, is what WHO says. And that is why we understand that we can do it, and we have been doing it for last 15 years in this center. Thank you very much. Thank you. Can everybody hear me?
Yes, sir.
Yeah, I'm
Thank
done.
you.
I can
Thank
take
you,
question and
sir.
answers.
Thank you for this wonderful lecture. And I will request Dr. Aditi to deliver your lecture. Then we will take questions from audience.
Okay, thank you. Thank you, Asif, Dr. Asif Iqbal. And thank you, Dr. Anjan Bhattacharya, sir. It was really wonderful hearing you. And I would like to share my experience and my knowledge. And is it possible to make me also a co-host? Because I would like to share certain slides. Will that be possible?
Yes, ma'am, surely. Just a minute.
Okay, sure. So before I go on to sharing my slides with you, I would just like to mention that in spite of the fact that my introduction has been given to you, I'm a medical faculty. Right now, I am posted at the Institute of Postgraduate Medical Research and Education, that is IPG SSKM Hospital. And I am in the Department of Medical Physiology as a medical faculty. And my research area is also neurophysiology of autism. But my only introduction to you today, as I understand that there are a lot of professionals and also parents over here. And today, on this day of World Autism Awareness Day, I would come from the point of perspective of a physician, a professional, but much, much more than that as a parent. I'm a mother to a teenager who's going to turn 14 very soon, who is on the autism spectrum. And as a mother, the journey is very, very different from that being a professional. So may I share the screen? Is it okay to share the screen now?
Yes, yes,
Is it visible? Okay.
yes.
Okay. So
Yes, ma'am.
yeah, the work that I do mostly, that we have a non-profit charitable trust named Samya Foundation for Special Needs, and for the last 7 years now almost, that we had been working through a research-based model on dance and movement therapy, known as Samya model of dance and movement therapy, and other on mostly based on autism and other developmental differences. And it is also a validated program with the fact that Tata Institute of Social Sciences, their course is being taught on Samya model of DMT. And also it's ISM Dhanbad, Indian School of Mines, Dhanbad, under IIT Dhanbad. So that has taken up a project where we are yet doing a research on the program. But before I go to the program, as a neurophysiologist, I would like to share a few things with you about the autistic brain. As Dr. Anjan Bhattacharya, it goes without saying, sir, has already explained, as a developmental pediatrician, what are the signs that we see, what are the flag signs. So I won't be going into the flag signs, but I would like to share a few things which are also, research-based models have explained. Till now, though there is no proof on the right etiology of autism. Nobody knows yet. Nobody can say that yes, this is what which causes autism, because every research is at a very hypothesis level. We have different hypotheses, but we don't yet know what actually causes autism. But when fMRI studies have been done on autistic individuals, that has shown autism is a disconnectivity disorder. Why a disconnectivity disorder? Here you see is the slide visible, which I am showing right now. Yeah. So I'm just going very quickly over it, the notable features of autism spectrum, because first and foremost, when a parent realizes that my child is different from the other sibling, or from my neighbor's child, or from my relations, or people are saying the child is not talking. But much, much before that, the signs have already started appearing in the child, which certainly enough, the parent, even me myself, being a doctor, is unable to identify if you had not been working with developmental pediatrics. But what happens, as parents, we get hooked up on the fact that the child is not talking. We are not interested if the child is communicating or not. Just right now, as Dr. Bhattacharya mentioned, that this child may not or may be making eye contact. Now, how am I going to find out that yes, this child is not making an eye contact or making an eye contact? Since I had not prepared any slide differently for this webinar today, I was not sure whether I could present. Just I would go back and forth on my slides to show you. Now, look at this slide. These are from two children with whom I had been working through dance and movement therapy. Now, this girl on the left side, this is a very common way how autistic children look. They have kind of a lateral vision, or they look sideways. So people feel that this child is not giving any attention to me, is not looking at me. But it may not be the fact. The child is probably noticing anything and everything that is going on around the child. If the child is non-verbal, parents would never understand that the child has noticed. But if the child is verbal, maybe after 2 days, this child will say, this certain things happened in the room on that day. And the parents would be surprised. We were thinking this child is not looking at me. So now, as a parent, do you think that only developing eye contact is really that important, or establishing communication is more important? What happens, I have seen parents, therapists, they work with the child, they hold the head of the child and turn it this way, turn it that way, to make the child establish eye contact. Now, I think as a neurophysiologist, as a DMT practitioner, as a physician, and mostly as a mother, this is insulting the child. You are insulting the child's individuality, the child's personality. If you had a visual challenge and you were not establishing eye contact with someone because of the fact that you cannot see, would it be wise for us to make you forcibly do that? No, not that. Rather, we can further facilitate a process through different exercises, what we do through movement therapy, through different exercises, which finally brings the child to a level on the right side where the child gets interested and establishes eye contact. When it starts, when this child is not establishing eye contact with you, what we also ask that, is your child pointing? So many a times parents will say, no, that my child doesn't point. But some of the parents would come up saying, oh yes, my child does point. But then the difference in pointing between an autistic child and a non-autistic child would be, suppose I am an autistic person and I am taking my mother towards a toy. I'm showing a toy on this phone, that I want this phone, and I'm showing my finger towards that phone and drawing my mother towards that phone. Now, if I am doing that, in this process, if I'm looking only at the phone and pulling my mother towards me, then at that time, that is a different kind of pointing. If I am a regular neurotypical child, I will look at the phone, I will look at my mother. And again, I will pull my mother, I will look at the phone and look at my mother. What am I trying to do? Both are here non-verbal, but they are establishing a communication. They are referencing through eye movement, through body gesture. This child is trying to say that, yes, I want that phone. I want to go towards that phone and I want you to get me that phone. The child is with autism is unable to do so. So actually this child with autism is unable to establish a communication. Many a times a child with autism might look like this. See, this is a very common thing. This any child would do, looking at the aquarium. Now, anyone among you could tell me that would this child keep looking at the aquarium like this if all the fishes were removed? Probably yes. Because this child is maybe not looking at the movement of the fishes. The child might be looking at the movement of the fishes. Many children with autism, they love animals, but some of them, they really don't have any interest upon animate objects. This child is maybe only interested in the bubbles that are there in the water, the movement of the bubbles, the movement of light, which is drawing attention of this child towards this aquarium, and may keep the gaze focused for a long time. Would you say that this child is not looking at a thing in a focused way? This child is lacking attention. Rather, this child is showing a kind of one-track mind towards a thing. And that is what, many grandparents come and say, oh, my grandchild, he has a one-track mind. It's very difficult to take off his attention from something that he loves. So on one side, we are saying that this child does not have proper attention and lacks communication. But on the other side, this child is having a lot of interest for objects for which the child is completely focused and would do anything to get that. So the core deficit areas and the associated characteristics are in a wide range of spectrum. The word itself is autism spectrum disorder. That does not only mean that someone on the ASD spectrum has to be either severe or moderate or mild. Rather, I would say any mildly autistic person, because right now we do not use the words as per DSM-5, Diagnostics and Statistical Manual 5, as Asperger's or other terms. Everything is under autism spectrum disorder. So someone who is mildly autistic or has mild autism, in India we have it as coding of ISA, Indian Score for Autism Assessment, with from 70 to 120. who fall within them, and through in different assessment scores they are different in ADOS or CARS. But what I'm trying to say is this mildly autistic person is supposedly a verbal autistic who is going to mainstream education, who has a capability of having a dignified life by working independently. But this individual itself may show a wide range of spectrum within himself or herself. So the spectrum does not only differentiate them based upon their ability. The spectrum lies within one individual itself. And that is the marvel of autism. How the marvel of autism? It's clear that I'm calling it a marvel of autism. See, this diagram you will find anywhere over the internet. And it shows that the parts of the brain which get affected mostly by developmental disabilities are these areas. I'm not going into the details of biology at the moment, but we know that cerebral cortex is responsible for our cognition or the intellectual functioning of the brain. But at the same time, the areas which are written in bold, amygdala, hippocampus, those are associated with our memory. Those are associated with our emotions. Some of the areas are related with our sleep. Basal ganglia, cerebellum, associated with body balance, with rectification of movements. The parts of the brainstem which are relaying information to other parts of the body. If supposedly, now just don't think of the brain, think of your house. You have an entire circuit in your house which keeps all the electrical facilities working. But today, all of a sudden, all the wires got mixed up, such that when you put on the switch you are switching on the switch for the fan, the light is on and the fan is not switched on. If you are putting on the switch for the AC, immediately the heater is turned on. What would you say? Where would you fix the problem? It's a generalized problem overall. The only thing that you can do is change the wiring. Unfortunately, in our body, it's not possible to change the wiring. Then what do? There can be other ways to do it. That is to develop new wirings. How do you develop new wirings? Or else grow new wires which will, in course of time, subdue the functioning of the already malwire adaptation. All right. How can you do that? That is what till now Dr. Bhattacharya was telling us, and we were hearing it, that through different interventions, we can do two things. The two things that we call in neurophysiology, one is neuroplasticity. What is neuroplasticity? Our brain is like a plasticine model or a Play-Doh. You can twist and turn it as early as possible, 4 to 6 years at the golden period of interventions. And or else neurogenesis. Yes, science is proof that new nerves do grow. And that is also stimulated through interventions. Now, how can you do so? I'm not going into any kind of interventional methods which involves injecting something into the body or any medicinal approach. I am just talking from the therapeutic perspective. Through different kinds of therapies, what do? It's training and retraining of the brain through different movements, through speech therapy, through occupational therapy, through learning, through special education, through physiotherapy. And yes, of course, it has been proved that here you see the functioning of the brain, which is shown by fMRI and diffusion tensor imaging, where it has shown that autism is a disconnectivity disorder. This disconnectivity disorder can actually be arranged. Here on the right side, you will see it's the, we call it tractography. The brain tracts are traced with dyes. And on the right side, which shows the red colored tracts, that those are of Dr. Temple Grandin. Dr. Temple Grandin, I think most of you know, she's the pioneer of the self-advocacy movement for autism, an autistic person herself. And I had a rare opportunity of meeting her while I worked at Thompson Center for Autism in US, in Columbia, Missouri. At that time, she was running the promotion of her HBO movie, and that's me. At that time, I was a young medical graduate. So it was at that time I had met her. And since then, I am not in regular touch with her, I would say, but I really like her work a lot. And she had volunteered herself for this study, where she showed that the neural tracts in her brain are longer as compared to a regular individual. So, too many adaptations, too many wirings in the brain, they cause commotion, and that is known as neural noise. Now, I'm just going over very briefly with a few practical examples of what actually Sir Dr. Anjan Bhattacharya till now had been talking about, which came into my notice. I noticed it because by virtue of the fact I'm a mom, and also I work with different moms, and through Samya Foundation, our main objective is to empower mothers, is to empower parents, because not everyone is privileged to receive the high-end therapies which are available in our city lives in metropolitan cities. Trust me. And I, as a parent, know that how difficult it is to go through it. I have done Doordarshan programs on autism awareness, and mothers call from remotest areas of Bengal crying that, I didn't know my child had a problem. And right now, my child is locked up in a room. I can only feed her 2 times a day and keep her, chained because my child is totally out of control. It is so painful. So I would say always, of course, go for therapeutic interventions, but parents, train yourself because you are the most consistent therapy for your child. Hey, I'm just coming to it. Look at these two pictures. They seem good, right? And they have different strokes and scribblings. These are made by an autistic child who was at that time only 7 years old. So they found place in exhibition. Now the same child, when goes to the school and makes a diagram of a regular plant, the diagram turns out like this. Would by any means anyone say that this child has a potential to be an artist? No. But the problem lies differently with this child, you see. Many people said that the child has problem in execution. The child has dyspraxia, such big names. For us as medical professionals, it is easy to handle these names. But this is not easy for someone who has no background of medicine or biology, or as a matter of fact, haven't heard the word autism ever. For them, it's like, it's a shock. But what happens to this child? Because this child cannot draw a single line continuously immediately when a break or intercept comes at the ground level. So you see, what we usually do, we either go from stem to the root or root to the stem. This child can't do that. And so the perceptions are different. Then at that time, I thought maybe there's a problem with motor coordination. I happened to talk to one of the self-advocates of autism in one of the conferences, and he came up saying, how do you know how we perceive? Do you know we perceive things like that? Things appear moving to us. This fruit, the flower, the leaves, they are not attached to the stem. They are separated because we perceive things like that. The reason when somebody's hair moves, I want to fix it by holding the hair. I just take off, snatch off the clip, the clutches from the hair because I cannot stand the movement. I take off the earrings from my therapist. The reason we ask therapists not to wear dangling earrings when they're working with an autistic individual. You might say, oh, be safe. You land up in an accident, but that's not an accident created purposely. The child has problem with something oscillating before his eyes. He wants to just fix it. So next is, we talked about this child. Any idea from the audience that what this picture on the right side actually meant? Any idea? Any random guess? Because I don't want to take up much time. And please remind me, Panita ma'am or Dr. Iqbal, that I'm running out of time. This picture on the right side, any idea? Anybody? Well, I came up with different answers. Some said pizza, some said window, some said sandwich. But the child who did it, when I asked him, he said that, oh, it's a samosa cut into half. Because this child was thinking in dimensions. This child was thinking about three-dimensional pictures. Because this child actually cut the samosa, he used to take off this masala inside the samosa and give it to his mother and keep the remaining. So the samosa appeared to him like this. Now, how would this child explain his observation, his perception to somebody when the child lacks communication? I saw a child drawing a saying car, and drew a car and showed it to me from no angle that was looking like a car. I just stood up from my table and I looked at the picture. And it showed the 4 seats inside a car, the steering wheel, the front lights, the back light. It was the car from a top view. They think in dimensions. They think differently. It's a brain which thinks differently. Just because you and me cannot perceive it, that doesn't mean it doesn't exist. My son, while learning geography, had asked me that from which level of the atmosphere does sky start? Does any one of us know from which level of the atmosphere, troposphere, stratosphere, ionosphere the sky starts? We never thought about it. We were taught up above the world so high, like a diamond in the sky. And how much above was it? They quantify. They think that way. But again, all of them won't be even like, just like we are different individuals, they are different too. It's not right to think that everyone born with autism will have a very high IQ. Everyone will turn up to be an Einstein. Everyone will, and even we don't know if Einstein or Newton had autism because they were not diagnosed at that point of time. We know that some of the traits were there, but any genius would have traits which would not make them very close to worldliness. So we cannot say that they had autism, but yes, they were also misunderstood at their point of time. So they might have had autism. And communication and interaction in autism, that's why it's very difficult. But when the mainstream school goers or the ones going to the vocational unit, I would say anyone having autism is fit for anything, but we need to figure out. We cannot label someone as severe and then push him to a vocational unit for life. And we cannot label someone as very intelligent and keep him in mainstream education for life and not ask for their opinion. But they can't get their opinion. So we have to facilitate that. And that has been my work through Samya Foundation, through dance and movement therapy, which I had been working on movements, the rate, range, force, and direction, how you hold up, and even in occupational therapy, you do that, how you hold a note, how you hold a glass. My tools are music and movements, but our goal is the same. Just look at this alphabetical order by an autistic individual. Do you see that? An alphabetically ordered, the words written in alphabetical order. Arrange the words in alphabetical order. That's the thing that is shown to most of us. But what do? We arrange the letters based upon the first letter of every word. But here, the child has arranged the word in alphabetical order. So, well, I don't want to get more into it because there's a lot to say. But I always want to say, look at this picture. We have to facilitate every child based upon their needs. We cannot say that, yes, we need equality. If this child is tall enough to look over the fence and see the baseball game, let the child not have a stool. But the child who is not able to see that, we have to provide the support to that child. We have to provide the required support, because my main aim of equality is to give 3 of them the same range of vision, not 3 of them, to drain the 3 of them in an attempt to look over the fence. So with this, I would end my discussion here, and thank you for making me a part of it. And yes, I'm also ready to answer your questions if that is known to me. For me, sharing is more important and meeting you all is more important. And yes, let every day be World Autism Awareness Day. That's my appeal to you as a mother, not as a professional, and of course also as a professional. Thank you.
Thank you so much, ma'am. It was an amazing session with you. Thank you so much. I request all the participants, if we have any questions to ma'am, you may ask, please.
Yeah, is the screen disappeared now?
Ma'am, I think there's no question so far. It was very, it was very much so good lecture that they have already knows about all the things that you have described the way. Thank you so much, ma'am, for this. And I request all the participants to interact with ma'am, that if you have any things to ask about the Autism Day or about any of the thing, please, you may ask. Please feel free to ask. We are here for the interactive session only. So yes, I just request everyone to participate. I think, ma'am, there's no question. We will conclude with this. And again, ma'am, it was an amazing session. It was literally, it was an amazing session with you. And thanks to Dr. Anjan, sir. Thank you, sir, for being here. It was an amazing session with you too. And thank you so much for being here.
Thank you. Thanks for arranging this.
Yes, same here. Thanks for arranging this. This is really very important that we talk
Yes,
more
sir.
about autism. And scenario, don't you think, Sir Dr. Anjan Bhattacharya, that scenario is changing? People are getting more aware, and then I feel that strongly.
Well, we are seeing referrals at a very young age nowadays. which is why I'm saying even, detect even more early, detect around 3 months of age. And then we can completely rectify, ameliorate all symptoms of autism.
So what is the, just it's out of my interest, I'm asking, so what is the first test that is conducted at 3 months of age?
Yeah, just give me 2 seconds.
Yes.
I have to put the charger on. Am I audible now?
Yes, sir,
Right.
you are.
Yeah. Sorry. You were asking about something. Please, could you repeat that question?
Yes, my question was, as you said, that in 3 months of age, you are right now detecting autism. So if you could also, because this is for my interest also, that what is the
Early
test
age of
that is-
presentation.
yes,
Early
what is
age of
the,
presentation. Yeah.
what are the
What
flag
can we
signs
do?
that a parent can notice at by 3 months of age, as early as 3 months of age, which should
Yeah.
make the parent aware? And what
Yeah.
are the tests that are conducted, the screening tests by
Yeah.
which you?
So the only test that can detect some risk of autism, which is about 60 to 66%, is using Practical's method. And advanced Practical's method, which is called general movement or GM. Some of your people will understand that, because in your institute there are people who are aware of this. So Practical's assessment can be done between birth and 3 months of age. Then the neurological assessment that we do is called Hines, as you know, the Hammersmith. But before that, this Practicals is actually designed to diagnose cerebral palsy, which it can do 98% accuracy. But incidentally, they have found out that these processing disorders, the disconnectivity issues, also up to 60 to 66% accuracy, which is quite high, because before 3 months of age, there is no test. There are tests for infant and toddlers ADOS. There are things that we can do at a very young age, but not at 3 months of age. And Duke and Davies University has shown us that if we detect autism symptoms or a risk of autism before 6 months of age, then we can ameliorate all symptoms of autism. And that is certainly true in our experience in our child development center. Not only that, we have this opportunity to actually do the correction even at a later stage. As you have said, even 4 to 6 years, we can do a very, very good correction. I mean, nobody would be able to tell also that there is any sort of features which makes them different. So that is 85% of our cases using Kolkata model.
Okay. Just asking another question, that what is that which makes parents bring you a child at 3 months of age? Is it a family
Actually,
history of autism?
they those antenatal risk factors I have shown: prematurity, low birth weight, bad obstetric history, especially
So based
valuable
upon either
child.
history or family history, because are there any flag signs that parents can look for at by 3 months of age?
No, they cannot.
that's
Not
what
even.
I'm
I mean,
thinking.
this can be detected even in a child who starts by giving social interaction. So they have developed the social smile, but has got autism. Later they will regress. Even that can be picked up by GM. They will have abnormal general movements.
Okay, actually, I did a study from 2 months of age, and that was presented in Indian Science Congress also. That was
Yeah.
based upon an anthropometric study, based on head circumference. So
There are studies on eye gaze, there are
by
studies
2
on
months of age,
auditory.
by two
All are
months of
for
age,
early
the
intervention.
head circumference was more than 98 percentile. So
This is
that,
where you are seeing a symptom. What I
yeah,
am saying is, even if you don't see a symptom,
okay.
you only know that a premature child or low birth weight child, they all are, they are all are at risk. So why let the risk fester?
So do you think
This is why the GM comes.
cerebral hypoxia, many children born, because I get a lot of children who have a birth history with cerebral hypoxia due to
Yeah.
obstructed labor and other things. So
Yeah.
then cerebral hypoxia, I have seen, it's my finding. I
Yeah.
have not conducted a study, but cerebral hypoxia is also I see this history very common among children coming with autism. So that they are also, they should also go for this screening tests.
Yes, yes. They are the ones, they are the ideal ones who should be referred for GM assessment. And our advantage is, because we are advanced trained, we can actually have an optimality score. We can actually score how accurately, how much,
Okay. Here is a question. So, whom is the question directed to? Here, I find a question. What is the prognosis of autism? Is there any
I am
difference?
trying to join using my computer now.
I am just answering from my part that
Yeah.
autism is a lifelong condition till now, as we know. And although there are different validations of the different cure methods, but nobody can still now say that yes, there's 100% cure of it. But the prognosis.
Let's
of
answer that question. It's a very, very big and important thing.
Yeah.
When
So
you
just,
say it is not curable, it is true.
Yeah.
Let us see. Is diabetes curable?
No, I'm just giving my point of view, sir. You please continue after that
Can you
because
hear
you're a
me?
more experienced person. But what I'm trying to say is when we talk
Yeah.
about the prognosis, I think
Yeah.
parents should live with the hope that we have to structure the life of the individual. We are not going to hunt for a magic cure and in the time lose the golden period during which we are not facilitating the communication and life of the person. Because cure for diabetes, as you said, is not 100%. The child had the person if with juvenile diabetes has to live on insulin lifelong.
It's not even juvenile diabetes. I'm saying there are conditions which will never
Yeah.
get cured, like asthma. It may
Yes.
never get cured, but do we bother about asthma? I mean, this is not curable.
So yes, that
This
is
is
what
not
I am
curable.
trying to say, that the
I'm disabled.
prognosis.
I'm disabled. I am enabled. I'm normal. This is what I'm talking about, because the results of Kolkata development model is that 85% of our children, they are coming with all severities, right? There are mild autism, moderate autism, severe autism. There are mild global developmental delay, moderate global developmental delay, severe global developmental delay, comorbid with autism. They have ADHD high, moderate, low. All these things, 85% of them are able to go to normal school, and then after few variable length of time, the average length is 8 months actually. 8 months. And you are very right, parents need to know. So we start with parental training. We don't accept unless parents go through the training, and it's a 1 week training only, 1 week training for life. So this child becomes integrated back to normal society and behaves like a normal kid. So you can see this comment to a child is a very disrespectful comment, right? We train parents that don't do this, because if you don't do this, then the child can hurl himself or herself into such potential. You will be absolutely surprised by the power of human mind.
Yeah.
And what you have just said, where we refine it a bit better, is that we want to say that yes, they can be living in their own world, but what if we help them to integrate it fully into our world? This is possible. This is possible using Kolkata development model, which is why I have been invited to talk in Royal College and all these things. We should join hands. We should do the researches and things. West Bengal University of Health and University of Technology should build up forces, build up workforces who can deliver this to every child. The LEAP-CP study that we have already done, which is world's first study and done in Kolkata, right? We should be now able to say that let's take this treatment to every doorstep. Duare Chikitsha. We should be able to do it. It's research proven. Why aren't we doing it? Because we have inertia. So just to bring the age of referral down to under 3 took 15 years of frothing through the mouth. You can see how I have a little pressured speech. It's because I am tuned now to froth, shout, to get things very easy to understand things, get through to people's minds, that if you get it into your head, you will not discriminate against your child, you will not shout at your child, your child will not go into a shell. You bring them out, treat them well, respect them, like, every parent should do. Just something that you must have witnessed in the Western world. I mean, their children do not get thrashed around. If you just practice that, that itself will create this magic. And
Yes,
then the bit of
parents are
technology will be
learning.
needed.
Gradually, in our country, it started late. Awareness came late. See, I am always for parents because as a parent, I speak from their shoes. So, of course, it's a life very different as a parent. It is not so easy. Parental frustrations are also there because
We
it's
cut
not
it
like,
short, ma'am. We cut it short. Over
yes,
here, within few months, those frustrations are gone.
yes, that's why I wanted to know. Yeah, thank
What
you.
what
It's really
what takes
nice
their
to hear
frustration
you.
away? What takes their frustration away is very quickly they see their child is normalizing.
And then again, all parents are not also able to afford it unless it is
No,
sponsored
no,
by the
all parents
government.
can afford. All our
No,
parents
no,
could afford.
you don't know how many parents we get from rural areas. They
I
are
understand.
clueless. They are clueless. From
Majority of my
Diamond
parents,
Harbour, from Sundarban, they are coming. They have no
majority of
idea.
my parents are from there only.
Yes, yes, that is what
They
I'm saying.
afford Apollo treatment because it's cheaper than the next alternative.
Okay.
Lifelong misery and expenditure. They understand that very quickly, and then they get better. I will give you an example. Somebody brought her child, somebody exactly who was doing something like movement and dance, not from a doctor community, very much from arts community, was doing movement and dance with their child and have been listening to my lecture 5 years because their institute used to take me on their annual function, if to give prize on my hands, and they were going to feel very happy that I am going there and lecturing. So she has been hearing me over year after year after year. It's only after 5th year it struck that it might be a good idea to get a assessment done. So she came to us, and this child is now 12 years old, right? Child comes to us and we assess him and we find that his mental age is like a below infancy, not even 6 months old at, that way. So we start our treatment. One of our therapists, we have a vision therapist, she goes to Canada. She went to Canada. She came back after 1 month, and she is then asking mother, so okay, where is his brother? So mummy is saying there is no brother. Then who is he? This is that boy. Well, wasn't he very disruptive? I mean, this boy used to place everything like, in pattern, all furniture he used to rearrange. And because he's 12-year, long, lanky, big, robust 12-year, it's very difficult to stop him. But after coming to our place, within a month, he has started sitting quietly. And after 2 years of therapies now, he's just pre-verbal. He has started saying, b. He has started doing that. We have not used any speech therapy up until now because it is pre-verbal therapy going on. So this boy has now completely normalized in the sense that from that 6 months, in 2 years time, his mental age is now 2.5 years, just pre-verbal to verbal, right? Now, this is what the magic of Kolkata development model can do. And there are
That's
so many
reassuring.
parents who have just waiting, where the treatment is right there next door. This is the message, really.
Thank you. It's really nice hearing you.
Thank you.
Thank you so much,
I,
sir. Thank you so much. Yes, it was very much an insightful conversation. Thank you so much.
we are out of time, it seems, right?
Yes, yes, sir. Thank you so much. Thank you, both of you, for joining this amazing conversation, of joining this amazing session. Thank you so much. Now we will conclude with the session. We are, thank you. Thank you so much, ma'am. Thank you. Yes.
Pleasure. Thanks. Bye.
Yeah. Yes. Bye-bye, sir. Bye-bye.
Goodbye.